In the diagnosis of heart failure, an echocardiogram is the most critical imaging tool. While a comprehensive report includes dozens of measurements, three specific metrics are considered the keys because they define the type of heart failure and provide the clearest evidence of how the heart is failing. Left ventricular ejection fraction is the most widely recognized metric and is the primary factor used to classify the type of heart failure. It measures the percentage of blood pumped out of the left ventricle with each contraction. Normal left ventricular ejection fraction is 50 to 70%. In heart failure with reduced ejection fraction is 40% or less, and the heart muscle is weak and cannot contract effectively. When the ejection fraction is 50% or more, the heart contracts normally but is stiff and cannot fill properly. That is heart failure with preserved ejection fraction. The other one is heart failure with reduced ejection fraction. Then there is an intermediate stage, that is heart failure with mid-range or mildly reduced ejection fraction. 41% to 49%. An intermediate zone often requiring close monitoring. As many patients have symptoms of heart failure despite a normal ejection fraction, we also look at the E by E prime ratio. This metric uses tissue Doppler imaging to estimate the pressure inside the left atrium, which is also corresponding to the left ventricular end diastolic pressure and known as diastolic filling pressure. The ratio between the speed of blood entering the ventricle, E, and the speed of heart muscle moving, E prime, is the E by E prime ratio. A high ratio, typically more than 14 to 15, indicates that the heart is stiff, requiring high pressures to fill. That is an important metric for diagnosis of heart failure with preserved ejection fraction. While ejection fraction looks at the pump, left atrial volume index looks at the reservoir. The left atrium is highly sensitive to long-term pressure changes in the heart. Normal left atrial volume index will be less than 34 ml per square meter. If the left ventricle is stiff or failing, pressure backs up into the left atrium, causing it to enlarge over time.